Once again, it's my pleasure to welcome you all to this event organized by the Center for Information Technology Policy at Princeton University. My name is Matt Salganic. I'm a professor of sociology and I'm currently serving as the interim director of CITP. It's my pleasure to welcome you here to this event where Professor Ed Felten will talk about COVID-19, technology, privacy, and civil liberties. Obviously, this is an incredibly timely and important topic, and we're incredibly lucky to have Ed give us a talk on this topic. Ed is the Robert E. Kahn Professor of Computer Science and Public Affairs at Princeton University. He is also the founding director of the Center for Information Technology Policy. In addition to his academic work in computer science, Ed has also served in a number of important roles in government. Most recently, he served at the White House as the Deputy U.S. Chief Technology Officer from 2015 to 2017. One of the things I love about Ed's work is he finds these really interesting, hard, and important problems at the intersection of computer science and public policy, and he's able to use his expertise in both of those domains to bring clarity to the issues that are at stake. And there's really no more urgent time that we need some clarity on some of these issues than right now. So one last word about the format. So we will be able to take questions through the Q&A feature inside of Zoom. What we'll do, you can put your questions in as we go, but we're gonna hold all the questions to the end. Then as a moderator, I'll read through these questions and ask them to Ed once the talk is over. So please feel free to put your questions in now as we go, and then we'll have them answered at the end of Ed's talk. So thank you again for joining us, and it's my pleasure to welcome Ed Felten. Oh, one last thing, just to clarify, the talk is being recorded. We wanna make sure that this information will be available to others as well. So please be aware the talk is being recorded. And with that, it's my pleasure to turn it over to Ed.
Great, thanks, Matt, and thanks everybody for your time today. I'd like to talk today about things happening at the boundary between technology and public policy related to technology response to COVID-19. I'll talk especially about privacy and civil liberties issues. And I'll be a little bit opinionated in the hopes that that's helpful. But please feel free to disagree with me either in the Q&A or later. So let me start with a little bit of background. The assumptions that I'm making here are about the future development, first of all, about the future development of this disease. We expect that the disease is going to peak, it will recede thanks to the success of the shelter-in-place policies that are in place in many spots, including here. So we're really looking at the post-peak strategy, what happens after the peak. And I think what we're likely to see is selective and gradual loosening of the restrictions on public activity, not just throwing a switch and opening everything back up, but selective and gradual loosening while public authorities are working to detect and contain flare-ups of the disease. And they'll try to steer that middle course, not opening things up so much that the disease starts to grow again, but not tightening it down more than necessary. And we're going to be in that mode probably for quite some time. A vaccine won't be available at first, maybe in 2021, maybe later. But until we have a vaccine, we're likely to be in that mode of selective loosening. Flare-ups will occur and public authorities will loosen and tighten restrictions in response to that. And we as individuals will also probably change our behavior and be more cautious or more bold in our public engagement, depending on how things are going. So the goal of the efforts that I'm talking about today are to try to figure out how to use information technology to help manage that post-peak world. And that really is through two main ways of helping. The first one is to help give public authorities and the public a better awareness of what's going on, of what are the conditions in society, what are the risk factors, and how people are responding to the changes that are being made, number one. And number two, to help authorities more precisely target the restrictions that are put in place. Rather than a simple binary on or off, rather than turning everything on or off within a state or a locality, to restrict just enough and in just the right ways to knock down the disease growth while allowing as much freedom of action to people as possible. So ideally, technology can help to do both of those things: better awareness and more precisely targeted restrictions. Okay, next, by way of background, I'd like to talk a little bit about the mathematics underlying infectious diseases, with an apology to any epidemiologists who are listening. This is, of course, a big topic. People make their life's work of it, but in a nutshell, I'll try to summarize what's important for our conversation today. So first, the critical parameter with respect to how a disease will behave in a population is R0, and that is the average number of new infections that are transmitted or created by each infected person. If R0 is greater than 1, then each infected person infects more people, and the number of infections grows exponentially over time. If R0 is less than 1, then you're in the opposite situation, and you have fewer and fewer people infected over time, and infections fall exponentially. The critical thing about this is that R0 can change over time, and it will change over time. And the actions that we take, the actions that public health officials take, can influence R0. The goal, of course, being to get it below 1, so that the prevalence of the disease will fall off exponentially, ultimately to near 0. Now, the baseline value of R0 for COVID-19 seems to be about 2.5, meaning that if everyone in the population is susceptible to the disease and we all just live our lives normally, that each infected person would infect about 2.5 other people, and the number of people infected would double about every 4 days. That's the world we were living in for some time before the restrictions started coming in. Okay, so what can be done to reduce R0? There are basically three things, three important factors that you can reduce in order to reduce R0. First of all, you can reduce how many people a contagious person encounters, right? You reduce the number of chances they have to spread the disease. You can do that by isolating people who are positive for the disease or who have symptoms. Although for COVID-19, that is not enough by itself. Even if you magically completely isolated every person with symptoms and did it at the instant they showed symptoms, it still would not be enough, because there's a lot of spread of the disease from people who are pre-symptomatic, meaning they will develop symptoms in the future, or are asymptomatic, meaning they don't have symptoms at all. You can quarantine people who are known to be exposed, or people who are for some other reason believed to be at increased risk of having the disease. And of course, the more extreme example of reducing the number of encounters is simply to tell everyone to stay home. The second major factor going into R0 that you can try to reduce is to reduce the fraction of people who are susceptible to the disease. So if an infected person, a contagious person, encounters somebody else, if that other person is not susceptible to the disease, then they can't pass it. And there are two ways to reduce that fraction. The first is by vaccination. That's the ultimate solution, but of course it'll be some time probably before we can do that. In the meantime, people might become non-susceptible because of immunity. Recovering from the disease may grant immunity. We're not sure about that scientifically. The evidence is still out on it, but it's probably true that someone who has had the disease and recovered will become immune. Now, that's a really painful and expensive way to reduce the fraction of people who are susceptible, but it is a factor that matters. And then the third thing you can try to reduce R0 is to reduce the probability of transmitting the disease if there is an encounter between a contagious person and a susceptible person. And the way to do that is the methods that we've all become familiar with: wearing masks, hand washing, and distancing ourselves in public. So all of these measures will play a role in trying to reduce R0 over time. Now, importantly, for COVID, there is no magic bullet. There is no single thing we can do which will knock R0 down from 2.5-ish to less than 1. What we're going to need to do is to combine several methods, each of which may be incomplete and imperfect, but each of which gives us some reduction in R0. And if you apply a bunch of different mitigations and they combine in the most simple way, you can think of each mitigation as multiplying R0 by some factor that's less than 1. And you just want to line up enough factors that are far enough from one that they multiply together to get R naught down to where we need it to be. So we're not asking for methods that are perfect, that are complete solutions to the problem that will solve it alone. We're just looking for a combination of things we can do. And then sort of the corollary of that is that this whole thing is an exercise in probabilities. If there is an encounter between a contagious and susceptible person, there is a probability of infection. If we do a test, there is a probability that the result of that test will be correct. And so again, we're not trying to do things that are 100% completely accurate. We're trying to do things that give us an advantage, that increase the odds in every encounter, in every situation. And if we do enough of those things, we can get to where we need to be. All right, so that's where we set the bar. Is this thing helpful? Does it improve this game of probabilities enough to be worth the cost? And with that background, let me move on and talk about the three sorts of things that people have talked about using information technology to do. First, people have talked about using it for mobility or contact modeling. The idea here is to generate some kind of aggregate data, heat maps or something like that, to help understand where do people go, where they encounter each other, what are the places and times and situations in which people may be at risk of passing on the disease in an aggregate sense. This could help officials understand which kinds of venues to restrict, which kinds of venues to open. It could help people understand how risky the things they do in their everyday life might be. The second thing that people have talked about doing with tech is some sort of immunity passport. The idea of having some kind of certificate a person can show, which shows that they have immunity. The idea being that if a person has an immunity passport, you can allow them to go out and to work in certain kinds of jobs that would otherwise be very high risk. And then the third thing people have talked about using tech to do specifically in this area is contact tracing. So the idea here is when a person shows symptoms or when they test positive, you want to figure out who has been in contact with them during the period when they were probably contagious. People are contagious for a period of time, of several days probably, before they show symptoms. And so you want to know who are the people who might have caught the disease from this person during the time that we know with hindsight, were contagious. And so that's contact tracing. So I'll go through each of these three areas and I'll talk about what has been proposed, and I'll evaluate each of these in terms of how much good they might do versus what the privacy and civil liberties implications might be. First, mobility modeling. And probably the best known example here is Google's community mobility report. You can go to Google's site about this and you can get a report for your geographic area. This is the latest report for Mercer County, New Jersey, which is where I live and where Princeton University is. And what this shows is over time, compared to baseline behavior, that is behavior before people were very worried about COVID-19, how much time are people spending in various places? And this is for this county. You can see how it's varied over time. And you can tell just by looking at this graph, when was the time when the shelter in place and other restrictions started coming in and people started their behavior. And so what you see is people are spending a lot less time on retail and recreation here, a lot less time in transit stations. Interestingly, the visits to grocery stores and pharmacies went down for a while and now are above baseline in recent weeks. Activity in parks is all over the place. People in general are spending less time in the workplace and more time at home, as you'd expect. So this shows, at least for this locality, people have changed their behavior pretty significantly over time. Okay, so that's an example of Google's community mobility report. More generally, mobility reports and risk modeling like this are done based on location data collected by smartphones. So if you carry a smartphone, your smartphone and you have location services turned on like most people do, your smartphone is collecting information all the time about where it is, and that information gets uploaded to or recorded by a lot of different entities. So that data is typically held by the mobile platform providers, by Google if you use an Android phone, or Apple if you use iOS. It's often recorded by mobile network providers like Verizon or AT&T Wireless. It's sometimes recorded by big apps that are location aware like Facebook. by mobile ad companies, and by others. So these types of mobility reports try to take these giant caches of location data that are held by companies and try to use them to gather aggregate data to report aggregate behavior over the population. So the fact that it's aggregate data is the good news from a privacy standpoint, but we do need to be careful. When we think about the privacy implications of this, the first thing to note is that aggregated data is not always or per se safe. Contrary to popular belief, information can be privacy violating even if it's aggregated. It's sometimes possible to infer individual data or facts about individuals from aggregate data reports. But you can prevent this. You can prevent this sort of inference of individual data from the aggregate by using methods like differential privacy, which in fact is what Google does for the report that I showed you earlier. And I'll talk in a minute about what differential privacy is and how it works. It's worth noting, though, as well, that in addition to the kind of mobility reports, the where people go reports, it's also possible to do some sorts of risk modeling. That is, by including not only aggregate information about where people go, but also aggregate or population level information about how many people are infected or how many people are immune in different categories or different places. And that can give you results not just about where people go, but about how many potential disease transmission events happen in grocery stores versus transit stations versus other sorts of venues, and breakdowns by time of day and all kinds of other things. Okay, the key to defense for privacy here, as I mentioned, is differential privacy. And let me talk a little bit about what that is, excuse me. So differential privacy is a known method in the computer science literature. The key idea of differential privacy is that before you report aggregate data, you're going to add some random noise to the data. And the idea is that the noise is supposed to wash out the effect of any individual's data. So if you see just sort of conceptually from this graph on the upper right of the slide, what you see is sort of two outputs from a differential privacy system. One output that might hold if your data is 0, and another data output that might hold if your data is 1. And this is showing the distribution of outputs that the system might produce depending on what your data is, whether your data is 0 or 1, say infected or not infected, or went to the grocery store or didn't go to the grocery store, whatever it might be. And the idea is that by adding noise, we can wash out the effect of any individual's data because the noise is bigger than the contribution of any individual's activities to the aggregate report. And you try to make the noise big enough to protect individuals, but at the same time, not so big that it washes out the aggregate data that you're actually trying to get. Differential privacy basically takes this idea of adding random noise of just the right size and puts a rigorous theory around it. It's a mathematically rigorous way to apply that idea. The precise definition of differential privacy is essentially that the result that you see, let's say that Google data set or graph, with your data included in it, is statistically nearly identical to what it would be if your data were deleted. And what that means is because it's nearly identical, because the difference with your data in or your data out is so small and is probabilistic in the right way, someone who tries to use that data to infer something about you will be unable to do so. And it's a very strong, rigorous guarantee. Okay, so Google actually does this. They do a good job of applying differential privacy. And importantly, they've published a paper explaining exactly how they do this, which technical experts can look at and evaluate it. This is really a best practice for aggregate data reports. So if this is done, if you're using differential privacy to generate aggregate reports and you're doing it in a careful and transparent way, this is a very safe thing to do and it provides clear value. So this is an easy case. This is something people should do. All right, let's talk about now immunity passports. An immunity passport, the idea here is to create a credential that certifies that a person is immune to the disease. Initially, they might be immune because they had the disease and recovered, which you can verify by antibody test. But eventually, they might be immune because they're vaccinated. And now the idea being immune people can then resume a normal work and social life because they're not at risk of catching the disease or of passing it on. So some economic activity can resume sooner. Now, this is likely to be of limited value in practice because of this unfortunate calculus that either relatively few people are immune or many people have died. If you believe that if the case fatality rate of COVID-19 is about 0.5% in the US, which is a reasonable estimate, then the number of people who are immune in the US will be about 200 times the number of people who die. And so in order to get to a point where 10% of Americans are immune, that would correspond to 165,000 deaths in the US, which is not a situation we want to be in. So if many people are immune, then many people will be dead, and we certainly hope that many people therefore are not immune. So the immunity passport has a bunch of downsides, in my view. The biggest one is it creates a really dangerous, perverse incentive to get the disease. Think of a person who is desperate to get a job, but can't because they don't have an immunity passport. Their incentive, the way to get a job, the road to a job is to first get the disease, then hopefully recover, which almost everyone will. Then having recovered, get an immunity passport, and voila, you have a job. So anyone who figures this out will have a strong incentive to seek the disease if they're desperate to get a job. Not everyone will, but enough people will that you need to worry about this. Second, there's an incentive to cheat. Because if an immunity passport is valuable, if it's the road to a normal job and a normal social life, a lot of people will want it. And there are various ways to cheat. For example, have somebody else take the test for you. This is something that's very difficult to prevent if we have home testing, for example. You could try to retake the test until you get a positive result. Or someone could simply try to bribe a doctor or a nurse or a lab worker to give a false result or to administer the test in a way that is known to be faulty and be more likely to lead to a positive immunity test. And then finally, there are serious issues of unequal access during a period when tests are likely to be expensive or limited, like the situation we're in now. So you can ask, well, can we mitigate the risk? Can we limit the use of an immunity passport to a few critical situations like hospitals hiring people to work near COVID-19 patients? Certainly, making sure that the people who work in those settings have immunity is really important. But while it's relatively straightforward to make an immunity passport, it's very difficult to create one that can only be used in such a setting. There are many situations where somebody could be coerced to show an immunity passport in settings that are not the critical ones that we want. It requires some kind of advanced tech plus a governance system plus rules. It's actually a very complicated and difficult thing to do. And then finally, immunity passports have a base rate problem. So let's do an exercise. We'll assume that 2% of the US population has disease immunity. That's a decent estimate for where we are right now. And we'll assume that a test has a 5% error rate, both 5% false positive and false negative rate, which is about where the state-of-the-art tests are now. So now we can sort of do this calculation and see how many people fall into different categories. So over on the left, we have about 6.6 million Americans actually immune, that's 2%, and the rest of the 330 million Americans not actually immune. So of the people who are actually immune, 95% will test positive, that's 6.27 million, about 330,000 test negative. Of the 323 million plus who are not immune, 95% of those will test as not immune, that's 307 million, and 5%, that's about 16 million, will test as actually immune. So if you're looking closely here, you can see the problem. Among the people who test positive for immunity, the majority of them are not actually immune. If you test as immune, there's a 72% chance you're not actually immune. And the only way to get out of this, this problem, so immunity passport is not actually strong evidence that you're immune in a setting like this. And the only way to get out of this either is to have tests that are much more accurate, which seems scientifically unlikely, or to have a much higher proportion of the population immune, which again is not a place we want to go because it means a lot more deaths. So there are lots of problems with immunity passports. And based on all of this, I think an immunity passport is not going to be the way to go. Okay, let's talk about contact tracing. The goal of contact tracing is this: when someone is diagnosed, you want to find out who are the people they might have exposed during the period where they were contagious, but before they were diagnosed. So the manual approach to doing this is by an interview by a public health official. And this is a really valuable method. So a public health official will interview the person who was diagnosed with the disease. They'll find out where they went, to whom they were exposed. They'll ask them to look at various records and so on. And they will then, either the public health official or the individual who is contagious will then notify the people who were likely exposed so that they will know to take some preventive action. Now, officials can compel cooperation and quarantine of people. They can compel cooperation from people who are contagious, who have been diagnosed, and they can compel quarantine of exposed people. Public health officials do have those legal rights. They don't always exercise them, but they do have a strong ability to do it if it's deemed necessary. That's the manual approach. There are many projects out there that are trying to use text to use a tech-based contact tracing method to try to make the process more complete and to automate it. So using tech might allow you to have location data that's more complete than human memory. So a person might remember they went to Small World Coffee to get a cappuccino at 10:30 on Tuesday morning. Their phone, which has their location records, will know that it was not about 10:30, but it was exactly between 10:21 and 10:24 a.m. The person might remember that they recognized some folks that they knew at the coffee shop, and of course, it's known who was working at the coffee shop at that time. But there are likely to be plenty of strangers who were there. Tech-based contact tracing can hope to identify who were the strangers who happened to be there at the same time that the now known to be contagious person was there. So this is not a substitute for the traditional manual approach to contact tracing, but it may be a really valuable complement to it because it can give you more completeness and automation in ways that the manual approach can't reach. Okay, so let's talk about how this might work from a technical standpoint. And let me show you what the user experience is like. So we'll start, I'll tell this story in 6 comic frames. In the first frame, Alice and Bob pass near each other. They're near each other, close enough in distance and for a long enough time that there was an opportunity for the disease to pass between them. Although both of them seemed healthy and well at the time, and they didn't recognize each other, they're strangers to each other. Sometime later, Alice feels sick. Alice goes to the doctor, and she gets examined, and she has a COVID test. Alice later receives the test results and finds out that she tested positive. Now, this is where the technology kicks into action. Alice voluntarily consents to having information uploaded to a server about where that conveys information about where she was during the contagious period, and that causes a device on Bob's phone to alert him that he was near a person who has now reported as positive. Bob, having learned this, can then take whatever actions he deems appropriate. He might decide to self-quarantine during a period in order to reduce the risk that he passes on the disease because he now knows he's at increased risk of actually having it and of actually being contagious. So that's the user experience. Let's talk about how it actually works. And you can break down the approaches to contact tracing via tech into 4 different approaches that are characterized by 2 different independent axes. So over here on the left, I have the first of the 2 distinctions, and that is, who is it that you're trying to notify? Are you trying to notify individuals who were exposed, or are you trying to, in addition to those individuals, notify public health officials about the identities of people who were exposed? And then on the other axis along the top, I have the other distinction, which is a distinction about what kind of technological approach you use to figure out whether Alice and Bob were near each other. We have first methods that rely on direct proximity detection. Here, Alice and Bob's phones are going to directly detect that they're near each other right now, generally without necessarily identifying that who they were. But they're going to exchange some kind of information that can later be used to check um, to check the fact of their proximity right now against information that's published later. That's one approach. The other approach is one that relies on location history matching. So here the idea is that Alice and Bob's phones just keep a complete history of where Alice and Bob separately have been over time. And then you're later going to somehow match Alice's location track against Bob's location track to see after the fact whether they were in the same time in the same place at the same time in such a way that there was a disease relevant encounter. Now, neither of these approaches is going to be able to say with 100% accuracy whether Alice and Bob were close enough to each other to actually pass the disease and for long enough to actually pass the disease, but it will be able to give, each one will be able to give an approximate result that lets Alice and Bob adjust their estimates of the risk that they might have been exposed to the disease. And remember, this is a game of probabilities. Okay, so there are 4 different approaches here, and each of these approaches has been tried somewhere. And I've labeled this graph with some of the places where these approaches have been tried. Okay, so how effective is this going to be? One of the most important factors for the effectiveness of a contact tracing technology is adoption. How many people are doing it? Wide adoption is a really critical factor, and here's the reason. That you need both people in an encounter to have the technology and to have it turned on in order for the technology to even notice that exposure event. So if one person out of N in the population adopt an app, it will see 1 over N squared of all the exposure events. So if half the people have a particular app, then 25% of the exposure events will be detected. If a quarter of the people have an app, then only about 6% of exposure events will be detected. And so what you see is that as the adoption falls off, that the percent of exposure events you cover falls off much more drastically. Fragmenting the market, having different apps that don't talk to each other, kills the effectiveness of this. In my view, the level of adoption is perhaps the most critical factor that gates the success of any kind of automated contact tracing technology. Most of these systems rely on users to voluntarily install an app. So what does that mean? Well, first of all, it's important to note that not everybody has a smartphone. About 81% of Americans have a smartphone. So if you do the math, that means that only about 65% of possible disease exposure events can be detected by a smartphone-based app, even if it's installed on and activated on every single US smartphone. Now that's still good, 65% is pretty good. But also importantly, the privacy impact of the system, how people feel about how safe it is to adopt this, will affect the rate of voluntary adoption. And because adoption is the most important factor for success, the privacy impact of the system is a really important factor in adoption. And the logic works like this. If a system provides better privacy and people know it, then people are more likely to adopt that system. Higher adoption means higher coverage, and in a quadratic way. So that means that if you increase adoption by X% for some small x, that the coverage, the fraction of exposure events that you will detect, goes up by more than double that, by more than 2x%. And higher coverage means better health outcomes. You have a better chance of being able to warn someone that they were exposed. So that means that for this application, at least, that the key takeaway about privacy is that we're not trading off privacy against human life. That is not the dynamic we're in with this kind of contact tracing app. Improving privacy is not something we begrudgingly do at the cost of human life. On the contrary, privacy helps us save lives through this equation. A little bit of better privacy means a little bit of higher adoption, which means a significantly higher coverage, which means better health outcomes and life saving. Privacy is the way to save lives for this application. That's not true for every application everywhere in society, but I think it really is for this one. All right, let me talk about location history matching as one way to do this. So this is where you record the full history of where Alice and Bob have been, and then later you're going to match it up. So you're going to match up the full location history. in order to, so one of the advantages this has over direct proximity detection, where Alice and Bob directly detect that they were together, is that location history matching can check for things like possible surface-borne transmission. If Alice sat down at the coffee shop and for a while, and then she left, and then Bob immediately came in, there's some risk of airborne or surface-borne transmission from Alice to Bob, even though they weren't there at the same time. If you use location history matching, you have a hope of detecting that, because you can check whether you were in the same place as a person who's contagious had just left. Unlike with the direct proximity detection approach. How much that helps is not clear, but it is at least a theoretical advantage. So in doing location history mapping, you can collect data by a new app, but probably given the importance of adoption, you might want to try to use data that was already collected by some company. But now the question comes about, can we match location histories in a way that's privacy preserving? And that turns out to be really difficult. It's probably beyond the state of the art scientifically right now. For one thing, location history tends to reveal identity. There are research results that show that if you can figure out where someone was at 2 random times within the last week, just 2 points in time chosen randomly, that pair of data points will, with high probability, be unique to that person. And that makes sense. That under normal living conditions, a person who spends the day in the office building where I work and spends the evening in the home where I live, that's probably me. So location history is very revealing of identity, and it's difficult to redact. It's also revealing of all kinds of things. Location history will tell whether you would go to a psychological counselor, whether you visit the office of an oncologist, whether you visit a gun store or an abortion clinic, or whatever place it is that you might consider privacy impacting. So redacting location history to make it not revealing about who someone is or what their life is like, very difficult. Now, there are methods that exist like private set intersection that people sometimes talk about that lets 2 parties compare a set of data points to see if they intersect without revealing more information, but that's really a sort of boutique one-to-one kind of matching. It doesn't seem like, or at least I don't know of a technical method that can do this kind of location history matching at scale in a way that is convincingly privacy preserving. Now, there's all kinds of things you can do to try to improve the privacy of these methods. And I'll put this slide up, but I'm not going to dig into it in a lot of details. People have suggested lots of things you can do. Can you use hashing, secure multi-party computation? Can you give all the data to a trusted party who isn't evil? All of these things might work on a whiteboard or work on the platform of PowerPoint, but when you try to transport them into the real world, not likely to work. Okay, let me turn the page and talk about direct proximity sensing, which is the method of automated contact tracing, which it seems to be in the lead right now. The idea here is that 2 devices are going to notice directly when they're near each other and keep some kind of record. So you might use a technology like Bluetooth for short-range communication. That's what the Apple and Google proposal that I'll talk about in a minute does. And the way that works is shown over here on the right. So every user on their device has a tracing key. That's a secret key that only that user knows. And from that tracing key, their device every day derives a daily tracing key. And then from that daily tracing key is derived by a publicly known method, a series of rolling proximity identifiers that change about every 15 minutes. And they look randomish. So your device broadcasts periodically the current rolling proximity ID. That's a random looking number that changes every 15 minutes or so. And your device at the same time records every proximity ID that it hears. So if Alice and Bob are having lunch, or they're having lunch at tables next to each other at a restaurant, Alice's device will chirp out a rolling proximity ID from that it generated, and Bob's device will record that, and vice versa. So if a person is diagnosed, if you're diagnosed, then you can consent to upload your daily tracing keys to some public server. Those daily tracing keys look random. And then everybody's devices, every day or so, will download all of the daily tracing keys of infected people that were posted recalculate what are the prox IDs that those people were must have been pinging out all day, and then check to see if they saw any of those prox IDs. So this business of uploading just the daily tracing key instead of the 100 or so rolling proximity identifiers that happen every day, that's a way of reducing the size of the upload and the download. But fundamentally, you can think of a new prox ID every 15 minutes broadcast by each device, and then the prox IDs of infected people being broadcast by public health officials with the consent of the people. Okay, so Apple and Google announced a system which works this way. And let me talk a little bit about how that works. Actually, first, let me talk about the trade-off in terms of who you notify. So one way you could do this is if you're aiming to notify just the exposed individuals, just Bob in my cartoon scenario, and that's how the Apple-Google approach works. The idea is that public officials would publish a list of the daily tracing keys of all of the confirmed infected people who had consented. Your app would download the list periodically and match it against the prox IDs that it saw. So your app will know whether there's a match, and it will notify you. But in this scenario, your app doesn't do anything but notify you. If the goal is to notify public officials about who is exposed, and that's the way that a similar system in Singapore has worked, instead, what you do is everyone's daily tracing keys are uploaded to public officials, and public officials have information about who was infected, and then they do the matching, and they send out whatever notification needs to be sent out. So in the case of Singapore, those officials were the Singapore Health Ministry. And that approach has some advantages if you're willing to share with public officials a list of everyone who was not only infected, which they already have, but also everyone who is exposed. All right, so the Apple-Google approach, which is the leading thing out there in this area, and it's probably realistically, maybe the only game in town in terms of an automated contact tracing approach that is likely to get broad adoption, or has a shot at getting broad adoption. The way this works is those two companies provide infrastructure and an API for doing proximity sensing via Bluetooth. Importantly, what they would distribute is not an app, but it's a toolkit for building these apps. And they would push the toolkit to all devices, but they would control which apps can use it. So although you would get the toolkit on your device, you wouldn't get an app that uses the toolkit to do proximity sensing, or even that turns on the toolkit, except through the normal App Store mechanism. So the companies say that they'll only allow apps that are officially designated by public health authorities, and only within certain privacy or data protection guidelines. And they say they'll use their control over which apps can be in their app stores, combined with their phone level security mechanisms, to make sure that that's the case. And so the scenario here would be that your state or local or national, depending on where you are, public health authority would officially designate an app which would be available to you on the standard app store, which you could then download and turn on, that would enable this functionality for you. Now, an open problem here, a problem that's easy in principle but hard in practice, is how to ensure that only COVID positive people actually report as positive and upload their daily tracing keys into this database. It's easy in principle because public health officials know who was tested positive. But in practice, given how decentralized and overloaded the health system is, and given the way that testing is likely to work, for example, with home testing, it might be difficult to make sure that people are not doing mistaken or even malicious things to try to put results into this data set. Okay, now let's drill down a little bit more into the privacy implications of this sort of system. Now, we need to be really careful to avoid the de-identification fallacy. And surprisingly, even some very prominent people who should really know better have made this error. There's at least one prominent proposal that has a good chance of being adopted by governments that gets this wrong. All right, so the de-identification fallacy would say that because the proximity IDs that phones are sending out are random or random looking, therefore they convey no information, and therefore they pose no privacy risk. But that's just not the case. And there's a simple counterexample. Suppose Alice and Bob, in my scenario, are friends who got together for lunch at noon on Tuesday. And their devices will then record each other's prox IDs for that time period, just like anybody else's would. Now later, if Alice or Bob's prox ID from that time reports as COVID positive, now Alice has all the information she needs to conclude that Bob must have tested positive. And the reason for that is that although the prox ID that Bob's phone chirped out at 12:15 on Tuesday was completely random looking, Alice knows that the person she was with then is Bob. So that prox ID, there's a reason it's called an ID. It is random. It is randomish, pseudo-random, formally speaking, but it is associated with the identity Bob. And so anyone who can associate it will be able to infer something about who tested positive. Bob's prox ID is a unique identifier. Okay, now, in addition to that problem, there are other attacks that people have identified that someone could try to do against this kind of proximity testing system. First, a paparazzi attack. The idea here is that a person or a group of people would get together to target some famous or prominent person, and they would try to get a sample of that person's prox ID every, let's say, 3 days. They just need to get near enough to them to get a prox ID. And then, if they've done that, they can find out if that person tests positive because they have a prox ID sample from the famous or prominent person. That's number one. Another attack is a coercion attack, where a coercer forces a victim to show up and provide a prox ID, and that would allow the coercer to figure out whether that person ever tests positive. Another risk is a risk of cloned devices, where someone arranges for many different devices to send the same prox IDs. Now, if the holder of any one of those devices is able to reports as positive or is able to report as positive, now anyone who came near any of those devices will be warned as at risk. Next, a COVID bomb threat attack. This is like a bomb threat where somebody might call in a bomb threat to a school or a business to try to empty it out for a period of time. The idea here is someone might go to a place and transmit prox IDs in a place, then report as positive. The goal being to effectively shut down that place because everyone who's there on a normal day has an exposure event. And then finally, people have talked about correlation attacks. There are commercial systems that try to do marketing based on identifying the presence of particular devices based on other unique identifiers sent out by a device, and to associate it to a known person who's the owner of that device for marketing purposes. Now, if somebody has a system like this, if they could additionally record the prox IDs sent out by those same devices, and then use the other identifiers from those devices to identify and associate to owners, they might be able to build a marketing list of COVID positive people. Now, none of these sort of attacks or scenarios are things that I'm introducing here that are new. They've all been discussed in prominently online or in the press, but they give you an example of the kinds of mischief that can happen and the kinds of things that countermeasures will be needed against, either countermeasures by law and policy or technological ones that will be needed in order to make a system like this as safe as it can be. And then finally, I want to talk about the question of the distance, the effective distance range of Bluetooth. Isn't Bluetooth short range, isn't that the best defense? Well, yes, with normal antennas, but specialized antennas can extend the range of Bluetooth a lot and target more narrowly. So we do have to bear in mind that at least sophisticated bad actors will be able to make antennas that can make Bluetooth contact over a larger range. So I've screenshotted here a Stack Exchange discussion from some years back where someone is working to set up a Bluetooth link between devices that are over 2,000 feet apart by building high power specialized antennas. Not huge antennas and not things that that require advanced industrial capabilities to build, but still specialized antennas. Okay, so there are some risks with this system. That's absolutely the case. So the question arises, is this a deal killer? The fact that this raises privacy risks and that these scenarios can happen. And in my view, the answer is no. I believe that contact tracing, automated contact tracing, if done well, that it's a public good, and that we should be willing in general to make some sacrifices and accept some risks as individuals in order to further important public goods. And this is an important public good. But the deal that I as an individual want to make with the rest of my community and with my public officials is that I would be willing to accept this risk if I know that all the reasonable steps have been made to minimize the privacy risks of this system. So that's the question that I would ask about how this is deployed and how it's managed. And that leads to the really important questions around transparency, governance, and trust. Success of a system like this depends on adoption. It depends on us being willing to step a little bit outside our comfort zone and take some risk for the public good. But our comfort in doing that depends on political viability, and it depends on public trust. That means that if you're a public health official, if you're a governor, if you're a national leader, you need to convince the public that you're doing the right thing and that you will continue to do that. These issues are complex, and that means that the steps you need to take in order to make progress are not simple. You need good advice, and you need broad perspectives that you can rely on to make this work. In the United States, it's state and local health officials who are going to be the key actors on this. So those people, those organizations need to have a way of getting good, solid advice from different forms of expertise and from different perspectives within their society. The challenge here is how to structure that, how best to go about consulting stakeholders, getting advice, and making decisions in a way that will garner public trust, and that will deserve that public trust. And I'm going to leave that as an open question. So, because that, I think, is the biggest challenge, and there are no easy answers. It's a matter of building coalitions. It's a matter of doing good public administration and doing good politics in the positive sense of politics. Okay, so bottom line, which of these technologies should we adopt? Aggregate data reports, to me, that's an easy yes. If we're using differential privacy correctly and carefully, then this is a safe thing to do. It's clearly beneficial. It benefits the public. It benefits public officials. Let's do that. Immunity passports, these are well-intentioned, but they look to me like a bad idea. I think they create really dangerous incentives. And in the world that we hope to be living in, where not many people have died, and therefore as a corollary, not many people are immune, they don't do all that much good. Automated contact tracing is a closer call. There are a lot of options and trade-offs here. I've only dipped a little bit into what the trade-offs are in terms of design, governance, and so on here. But the crucial factor, the most important factor for the success of this is adoption. And public confidence, justified public confidence that a system is well-designed, well-governed, well-managed, is what leads to adoption. That's where we need to get. This can be done safely enough so that, in my view, we should be willing to adopt it. We as individuals should be willing to opt into it, but it's not an easy task. And everyone in public life needs to be asking themselves, what can I do to help that happen without getting in the way of helping it happen? Okay, at that point, I'll stop and I'll take questions, with many thanks to the large cast of people who have helped me understand this issue, educated me, and influenced my thinking. So I welcome questions. Thank you.
Fantastic. Thank you so much, Ed. At this point, everyone, feel free to enter your questions into the Q&A dialogue. And Ed, I'll go ahead and start asking some questions. So I've noticed the questions seem to fall into kind of 4 broad categories. Maybe if you go back one slide. Some of the questions were really about aggregate data reports, some were about immunity passports, some were about contact tracing, and then some were kind of overall assessments. So maybe I'll start with the questions that came in about the aggregate data reports. So you generally seem to be very enthusiastic about those if they were done with differential privacy. There were a number of questions about why differential privacy was necessary, who could certify that the differential privacy is being done correctly, and whether certain people are left out of those data. So for example, how is Google getting this data? Is that only including certain types of people? So maybe you could talk a little bit more about those questions.
Sure. Okay. So let me start with the last one. Who's left out of the data? Where might the data be coming from? So who's left out of the data? For number one, people who don't have smartphones are not in this data. And of course, we know that people who don't have smartphones are disproportionately people who are poor, who are socially and economically disadvantaged in various ways. And that often correlates with people who are in high-risk groups for this disease. So that's definitely an issue. There are probably ways to partially correct for the bias in who has a smartphone, but those won't be perfect. And folks like Matt would be much more expert than I about about the social science needed to do that. Google is using in their reports information about the people who are using Google's location services. So that's folks who have Android phones, as well as presumably people who use certain kinds of Google services that are always on their phones. And that's also not everybody. One of the nice things about differential privacy is it gives you a really clear recipe for ways of combining aggregate statistics across different companies. You could have a Google report and an Apple report, which you can safely aggregate together if you do it in ways that are well understood in the literature and not too complicated. And so there are ways of aggregating across different data sources. But of course, you're inherently limited on smartphone data based on who has smartphones. Working back earlier in the question about aggregate data reports, how do you know whether, so why am I enthusiastic about differential privacy? And the reason I'm enthusiastic is that differential privacy is the only theory really that we know of that can give a rigorous guarantee about the possible amount of statistical privacy exposure that an individual has in a particular report. If you want to be able to give a guarantee that you can stand behind with math, then differential privacy is really the only game in town. And what differential privacy is fundamentally for is for a test like this where you have sensitive individual data and you want to calculate safe aggregate data from it. That's really what differential privacy is for. Now, just saying we use differential privacy is not by itself enough to make something safe. You have to use it in a way that's safe. And with the parameters in the system, the so-called epsilon values being chosen judiciously. So what companies should do is what Google did do with their mobility reports that I showed, which is they published a pretty detailed technical description of what they did, exactly what algorithm they proposed and which they used and which parameters they use in a way that could be vetted by experts. And then they used an open source differential privacy library, which was published by them, but that part isn't so critical. So that people can know that they've used code that's been publicly vetted to do the privacy aspects of the calculation. And if that part was done correctly, then you know that the result is safe from a privacy standpoint, even if they messed up the way they collected the statistics. Now that is a process that requires expertise, and transparency and public attention is the answer. It might be useful to have experts write down a set of consensus best practices for using differential privacy for something like this.
Okay, thank you. There are a lot of questions about the contact tracing, and that one seems one of the most complicated. So I'll go relatively quickly through immunity passports. But there were some questions about that as well. So One was, you came down, relatively strongly against immunity passports. Have you written this up, or is this written up somewhere that people could reference?
It's not written up publicly yet. That is high on my to-do list.
Okay, great. And then another question was, have people done this in other countries, the immunity passports?
There's been discussion of immunity passports. I know there's been discussion in the UK. In China, they do have a kind of disease status passport, which has been made mandatory, as I understand it. That's probably, and that's more than just immunity. That is, as I understand it, a sort of risk level categorization, a red, yellow, green kind of system. Okay, yeah, so this has been proposed elsewhere, but I don't think I'm in a position to access that information right
Okay,
now.
and then another question about immunity.
And Italy, I'm sorry, this has been proposed in Italy as well.
And then another question about immunity passports. There were several versions of, I think people found the calculation of the base rate, the 2x2 table where you showed even if you are, so there were questions about, well, if you change certain assumptions about maybe you give people 2 tests, or maybe you're only likely to get a test if you are more likely to have it, so on. So do you think that your assumptions kind of came down in a way that makes immunity passports look less effective than they could be?
I mean, I think that's fair. There are things you could try to do. You could say test twice, but now with the tests have an error rate, the question is a false positive test repeatable for the same individual? Because if so, then testing multiple times doesn't help to the extent that is true. If it's not true, if it's truly independent, if the same individual takes the test more than once, now multiple testing might help, but also you're open the door to people taking the test multiple times in order to game the system. I'll go to clinic A and take the test a bunch of times and then see if I look positive. And if not, I'll go to clinic B and do it again. And so you need to take into account strategic behavior by people if that's the situation. You could really play this out in a really complicated sort of game theoretic way and look at different strategies and so on. I didn't want to go there, but I wanted to give an idea of why base rate issues are a pretty substantial problem here, which I think is true regardless of how you tweak the model.
Okay, very good. There's a very interesting comment here about the history of immunity passports. Someone mentions that in New Orleans during yellow fever from 1800 to 1850, there was a number of discrimination in hiring and housing based on whether someone had this history.
And I think that history is really interesting. Folks, I'd recommend folks go look at it if you're interested in this topic.
Okay, so moving on from immunity passports, I want to save time for the automated contact tracing, as well as some kind of overall assessments that kind of cross all the different methods. A number of people asked about false positives with the automated contact tracing. And so I'm wondering if you could address that concern. Yes. So just to elaborate a little bit more, maybe you could summarize the concern.
Let me talk a little bit about it, right? So the automated contact tracing is going to report that there was a contact between two people if their degree, if the estimate of their physical proximity and how long it lasted is above some threshold, right? And there will be both false positives and false negatives there. That is, this system will think that two people had an exposure event sometimes when they didn't, and it will think that they didn't when sometimes they did. And so that's one way in which this this kind of warning from a automated contact tracing system is going to give a result that is sort of only accurate on average. And of course, the other thing to note is that we have the 6 feet or 2 meter radius, which is like the radius of safety. And there's some period of time, let's say, I don't know, 2 minutes or 5 minutes, whatever threshold you set. Those thresholds are not sharp, right? If you're just outside the 2 meter line, your risk is only a little bit lower than if you step just inside the line, right? This is not a 3-point line in basketball where there's a big difference when you cross that line. That's just kind of like where the knee of the curve is, right? And so all of this, remember, is a game of probabilities. That if this system triggers for you once, you can probably conclude correctly that your risk of being infected right now is a little bit higher than it would be had it not triggered. And what we're really talking about is this game of probabilities, that this is a system which will help people estimate the risk that they're infected right now. And as long as it's accurate on average, then it's an improvement. And it will lead to, because what you want to do is get to a situation where people selectively self-quarantine in such a way that the people who self-quarantine, some people self-quarantine and some don't, and the ones who self-quarantine are on average at higher risk than the ones who don't. If we do that, then we can get ourselves to safety with fewer people self-quarantining, which is what we want to do. And so it just needs to be accurate on average. It's of course an empirical question how accurate it is, but it seems to me, based on first principles, that you ought to be able to build a system that is accurate enough to be helpful.
Okay. There were another cluster of questions, I think, related to legal issues regarding this kind of what you call the Apple-Google approach. So one is related to HIPAA. Another seems to be about the Fourth Amendment. Another seems to be about legal oversight of the apps that people are building or the API that the companies are creating. What entity would the FTC oversee that? Without a kind of comprehensive privacy regulator in the US, how would that all work? So again, a bundle of legal questions related to potentially HIPAA, the Fourth Amendment, and oversight potentially from the FTC.
Okay, so first HIPAA, the answer to that one is I don't know. You have to ask someone who really understands HIPAA better than I do. HIPAA is a bit of a mystery to me. Certainly this is health related data, and some of the information comes from the results of medical tests. On the other hand, this is a system which, as most people envision it, would operate with the individual's consent. So with respect to the Fourth Amendment, again, I'm not a lawyer, I'm not a Fourth Amendment expert, but the argument that this is okay, I know rests heavily on consent. That individuals are not, if individuals are not required to download or install an app, and therefore they're not required to turn on the code that these companies have shipped or the outgoing Bluetooth beacon, and if when they test positive, they're not required to upload their data to the central server, and if they get flagged as having been exposed, they're not required to tell anyone, then my intuition as a non-lawyer is that, and if much of this is done, and if the code to build it to do this is built by private entities, then I think those factors together are likely to mean that this is not a problem from the Fourth Amendment standpoint. I think as soon as you have decrees that force people to do things that are not already allowed by public health, things that public authorities can't already mandate because of public health laws, then if that were to change, then I think you might be in a different Fourth Amendment territory. Questions about oversight of this. Yeah, I think that's a difficult one. Somebody needs to be overseeing it. Whether the FTC would be found to have authority to do that is a little bit complicated. I would assume, having worked at the FTC, again, not as a lawyer, but having spent a lot of quality time with the FTC Act over years, that certain sort of egregious things that the companies might, in theory, be able to do could be FTC Act violations. They could be unfair practices. Certainly, if the companies were to materially mislead people about where the data was going, if we were to find out that the companies were like collecting everyone's disease status without telling people, they would, I have no doubt, be in big legal trouble. But like, which public entities, which government entities would be in a position to oversee this sort of whole public-private ecosystem of activities? That's a hard one. In an ideal world, state health officials would do it. There is an association of state and local health officials that could, in principle, do work in this space. You can imagine the National Governors Association or somebody else getting into this space. You could imagine some kind of national consortium to do it, or something like that. But there is no clear actor who is the obvious overseer of this. And that's one of the challenges we have when it comes to understanding how to govern it. Without a clear overseer, it becomes harder to get people to broadly buy in to the proposition that this is safe and has appropriate oversight. But it's not obvious who that would be.
Thank you. So another cluster of questions seems to be around the social response to deploying the automated contact tracing. So one is about, questions are about what you think, how individuals will voluntarily decide to adopt this or not, your projections about that. One is potentially unintended consequences of once people start getting all these buzzes, will that change their behavior? Will people engage in riskier behavior because they think they have this? And then related to unintended, the encouraging risky behavior, do you think this could also change the political system to encourage potentially riskier behavior?
Yeah.
So I guess the broadly social, what do you think of the social factors will be in individual level adoption and then risk of unintended reactions?
I mean, for individual adoption, it seems like there will be two main factors. One is, to what extent does the person believe that COVID-19 is actually a big problem in our society? And there's some evidence that some people don't believe that, despite the overwhelming evidence that it is a huge issue. And then the second is issues of sort of trust and confidence in the technology and the systems around it. Do people actually trust that the assurances they're getting about privacy risk and about the management of this and about how the data will be deleted after 14 or 21 days or whatever the guarantee is? To what extent do they believe that? And those are the key factors. And how you get to more people feeling comfortable about those things is to me an open problem, but really is what those governance and coalition building challenges are about. As to whether this encourages risky behavior, I'm not sure it will. One of the important aspects of this is it doesn't tell you in advance when you're taking a risk. It tells you after the fact that a thing you did turned out to expose you to risk. So if you get told that 2 days ago, the place that you went was a place that you went exposed you, that doesn't inform your decision 2 days ago as to whether to go to that place or not, right? This is not a technology that tells you that it's safe to go to some place right now, because the whole system as a whole doesn't know, right? Assuming that people who actually have tested positive are already quarantined or are already isolated, then everyone who's out there is a person who doesn't have symptoms, and everyone who's out there could be a carrier, but you just don't know, right? So you can look into a place and see, well, it's pretty crowded, more likely there's a carrier in there, but this thing is not going to let you know in advance. One thing it might let you do is say, well, you know, I went to the coffee shop last Tuesday and I didn't get a buzz on by Friday, so maybe I'll go back again. But on the other hand, maybe you went on Tuesday and you got a buzz on Friday and turned out you didn't have the disease, right? So that cuts both ways. And as to whether like there will be this warning fatigue, that people have these like buzzes and warnings all the time, this is one of the important ways, this is one of the important aspects of how a system is designed, is sort of what is the threshold for warning people. Depending on what the prevalence of disease is, it may be that it's not a good idea to buzz a person if they had one exposure event and it was for a relatively short period of time. It may be that it's better to say, well, we're going to keep a sort of cumulative risk score for a person, and only if it goes above some level are we going to actually warn them. Or maybe we're going to have a different kind of user experience where they can check the app every day and it says, you know, your risk level is in the 68th, is in the 70th percentile or the 30th percentile or something like that. So there are different user experiences you can do, and it's a matter of user testing as well as some amount of user experience foresight that people who are good at this kind of thing would know what to do. But it is really important to try to get that right.
And just to clarify, who will be making those decisions about the user interface? It sounds like Apple and Google are just going to provide the plumbing, and then who would build these? Would these be built by governments, state health agencies?
This is a really important question, right? So, you know, your state health department does not have software development and user experience design as core competencies. Also, your state health department has some other very important things to do right now. And so, although they are the ones who are ultimately, who will ultimately be making decisions about what is the official app or which are the official apps in your particular locality, they won't be the ones building them. So as to who builds them, that is an open question. It's a really important question, and because these kinds of decisions will be recommended by experts or developers to the state and local officials who are ultimately giving the blessing to particular kinds of apps. But it's a difficult governance question, how to make sure those decisions are made well.
Okay. So we have just a few minutes left, and I think we'll move into the last category of questions, the kind of overall questions. Whichever of these approaches are tried, or potentially other approaches that will come up in the future, there are a number of questions that ask about kind of long-term impact of normalizing increased surveillance. How do you think about not just the short-term trade-offs, but the longer-term trade-offs in terms of changing social norms?
Yeah, so I mean, I think this is important because this could be an improvement, or it could be another step down a slippery slope to more data collection and surveillance, depending on how we do it. There are really important questions such as how long is this data kept? How long is this functionality present in our phones? Ideally, these capabilities would be designed to sunset, and there would be some kind of public step that companies or officials would have to take to keep it going at the end of a period. So the sort of automatic sunset with a explicit positive step and public step that needs to be taken to extend it is important, because it creates touch points where the decision to have this exist will and be turned on will be reconsidered. Also, it's important to design the text so that if a user installs this thing, that there is some built-in mechanism that reminds them and asks them if they still want it on a periodic basis, right? So those sorts of safeguards are really important. The sort of governance and privacy management stuff that we do also really important. Limitations on use to the extent that regulations can be made, or hard and fast rules or legal commitments by corporate players can be made, which box them in and make sure that that scope drift is more difficult. That's also really important. But we should also recognize, I think, that this is not going to be the last time that we have a pandemic start to pop up, and that we're going to need as a society to be ready for the thing that started happening with COVID-19 some months ago, right? Had we had the toolkit that we hope to have by June or July ready to go back in, let's say, January in the United States, and had we been prepared to turn it on, we'd be living in a very different situation. So I think the idea that we may need to turn this back on, really important. But one of my fears here is, and I had an op-ed sort of based on this idea with my government colleague Adam Klein a while back, is the analogy to 9/11, that there's a risk that we'll get into a situation which is like what we were in immediately post 9/11, where the public is terrified and freaked out and traumatized by the scope of what happened. And there is a mood that we should just do anything that might help. And that leading to a series of expanded surveillance authorities for government and a normalization of more corporate surveillance. And there is a risk of that. Though there's also a positive lesson to learn from 9/11, which is that, with all of the challenges that we had, with the rush to turn on new authorities, and operate new authorities, some of which were on questionable legal ground, there were also a bunch of new safeguards that have come in. There's been more transparency. There were some new structures within government that were set up to try to help manage this, such as the creation of a new agency to oversee the intelligence and law enforcement agencies on privacy and civil liberties. And I'm honored to serve in that agency right now, the Privacy and Civil Liberties Oversight Board. So there's some positive things. I think we can learn some things from the experience of 9/11 and try not to repeat the mistakes, and try to do the positive things that were done post 9/11. But certainly, I think it is an inflection point potentially in our relationship to surveillance.
Also, looking more to the future, there are a number of questions about trust. So it seems like some of the questions asked, like, how could we trust Google and Apple? Some asked, how could we trust public health officials? How could we trust the federal government? It seems like there's a lot of mistrust of many of these entities, and many of the entities themselves don't have a lot of trust with each other. And so how do you think we can go about building that trust to help respond to this event and potentially the other events that will come in our future? How do we have trust that is legitimate, or, as you said, meaningful and
justified?
Justified.
Yeah. How do we have justified confidence?
Yes.
So, and we can ask this generally with respect to these companies and agencies as institutions, and we can ask it about the specific things they do in response to this situation, say about a specific contact tracing ecosystem that evolves. And the answers are similar, I think. Trust comes, first of all, from those who have responsibility and power using it in a way that is responsible over time. It comes from transparency and some humility from these bodies, so that people have an idea of what they're doing, to the extent that this technology can be open sourced, to the extent that the information about how it works can be published, to the extent that the decisions that are made are conservative from the standpoint of how much trust people have to put in the technology, right? There are ways of designing institutions, ways of designing technologies where more of the critical things are available and visible, and ways in which they're less. And it's really important to do those things. It's also really important, I think, there are entities that can act as validators for what large institutions are doing who are independent, right? And making sure that those validators, first of all, are able to get the information they need so that they can be confident in validating a thing as actually good. And of course, making the thing actually good so that they're right when they validate it. And then figuring out how to organize that process is really important. And there's no simple single answer to that. But transparency is important, and checking is important, and then structuring things so that there is accountability. And then finally, making sure that before people make decisions and as they make decisions, that they're talking to and seriously consulting with, and not just accepting unused input from all of the stakeholders they need to talk to. And that means people who know things, people who are experts in various areas, but also communities who are affected by this and who might not otherwise be heard. It's really important to have that kind of consultation and to have it be genuine and happen from early in the process. Not we're going to decide what we're going to do and then we're going to bring people in and sell this to them, but we're actually going to engage them in a dialogue about how it might work and what kind of safeguards are needed. All of that is, that's hard work, but there are people who know how to do it, and it's really important to do it.
Well, that seems like a good note to end on. So Ed, thank you so much. For those of you who enjoyed Ed's talk, I want to encourage you to check out the website for the Center for Information Technology Policy. These kind of events at the intersection of technology and public policy, we organize them frequently. And if you visit citp.princeton.edu, you can learn more about the events that we host, and you can also sign up for our email newsletter. So again, thank you so much, Ed, and goodbye.
Thanks everyone for your time.